I think personalisation and personal budgets have come about from two directions. One would be disabled people themselves wanting more autonomy and control over their lives. I think the old system was quite patriarchal. It sort of told people what they could do. There wasn't much choice. So personal budgets just put control back to people. But there's also the political thing that it was a sort of progression from Thatcherism and the marketisation of social care, which the last government and this government seem quite interested in doing.
The key reason why it is here is because it's kind of like a follow-on from when disabled people want the right to direct payments, saying, I'm getting this support, the public purse is paying for this support, so people would be saying to the local authority, why don't you give me the money? Yeah, build safeguards and everything, okay, so that to make sure that I spend it properly, but give it to me because I know best how my needs should be met.
Personalisation is a method of living more independently, having a better health, a better well-being holistically. Personalisation is about getting the right support you need for the right physical needs you have, making sure it's what you want when you need it, and how you need it.
There's lots of different terminology used for personalisation. Council workers love terminology. And certainly since I've been working in personalisation, the terminology has changed. When I first started in 2009, it was all about individual budgets. Now in 2011, it's all personal budgets. I'll just give you a different description of each one. So an individual budget is meant to be the money from different sources. So your money that's available from social services, you might have your money that's available from the individual service fund, or you might have money that's available like benefits or other benefits in that pot to use for your support. A personal budget is just the money that's available to meet your needs from social services. Okay. And a personal budget and an individual budget, essentially what that means is the money that the council has agreed to spend on your support, instead of saying that comes as a care package, it just comes as a pot of money, a budget of money. Now, if you want to take that money and go and purchase your own services, you would take that money as a direct payment. Okay, so direct payments are they're already in place. It just means you take your personal budget as a direct payment. Okay, we also have individual service funds, and individual service funds are where you may identify a provider and you will give that provider the money for you, and they will help you plan your support and manage your budget for you.
They, as in the government and the Department of Health, have used terminology and words that are very similar to each other and that can be very confusing and very complicated. But don't get hung up on that. Don't let it put you off. Don't let it divert you from taking the journey through. It is just terminology.
My name's Martin, I'm 28 years old. I grew up in Cambridgeshire. I have a genetic disability or impairment called spinal muscular atrophy, which basically means that I rely on a wheelchair to get around from A to B all day long, and I have to have 24/7 care support to enable with personal care, domestic tasks, going out socially, to meet with friends and family. I think personal budgets looks at life in a more holistic way, so it's more outcome focused. So it's not just how to get out of bed and how to get a shower, but it's how to go to the pub and meet your friends, or to access local leisure or health initiatives. So it's a bigger picture, whereas direct payments probably makes up a part of the personal budget programme. I found the assessment process a little bit scary actually. I think when you have care needs and you know that you need a budget to underpin and support those care needs, it's a kind of crucial part of living life, and so the fear comes in that will the budget be sufficient. And also there's a lot of questions that you have to comprehend, things you don't normally think about every day of your life. So I live my life very out there, I've got lots of friends, I live a fulfilled life. I don't dwell on my disability and consider all the things I can't do. So it's quite strange when you have to really articulate the things you can't do and what that means. But without doing that, the assessment can't be made and the budget can't be provided. So there's a scare factor and an uncomfortable factor in addressing some of those thoughts and processes. But it's a fundamental aspect of being able to get out there and live the life you want to.
A couple of years ago I had the stroke, and since then I'm not very well actually. And I have to look after my wife also. She's sick and she's disabled, and she's have problems with the memory actually, with Alzheimer. And that's why we're getting those money from the council to look after my wife, and I have my son looking after us actually. When the social worker came here and she wanted to ask us a lot of questions, she asked us if we can get the money ourselves and dealing with this money with the agencies and with the people who want to employ and look after us. So I agreed that it was much better to get the money and employ anybody I want from the family actually who can look after us. And that's why I accepted, and I'm very pleased I got it. The best thing is that you can employ whenever you want, whatever you want, from whenever you want. I mean, if you don't like the agent and the woman who is coming here, just phone them and say, sorry, I will change the agents, and that's all.
I wasn't born disabled. I became disabled in 2003. It was a huge shock for me, as you can imagine, and I found it extremely difficult to cope. I went into hospital, into rehabilitation there, had to live there for a period of time, and then came home and had nothing. My home wasn't disabled friendly. I didn't have a social work, I didn't have an occupational therapist, and that's when I realised that I had to do it and find it myself. Personal budgets have made a huge impact on my life, and they've made a massive difference to it too. I've been able to become a lot more mobile. I've been able to get out and about a lot more. I've been able to take care of my physical needs much more that are much more appropriate for what I need, whereas before there were certain things that I couldn't do and couldn't have. I now have that as support. I was able to look at the whole community care plan and look at it on a level that was not just about a physical and medical need, but a holistic need. So the original pilot process that and the idea of personalisation most definitely helped me. It definitely changed my life for the better. Of course it has its disadvantages, and there are things that haven't gone well with it and things that aren't brilliant about it and that could do with changing, but nothing, the way I see it, is nothing in life is perfect. And if you found something that works and can work, if you work around it, then why not? And at the moment it's the best thing that there is out there.
For organizations, I think it's a little more tricky, because organizations such as, Rethink and Mind and other organizations then have to become more business model driven versus being government funded. They have to create services that people want to use their personal budgets to buy into. So in that context, I think a social worker I work with the other day seems to feel that this is a covert way to take away those sort of mainstream services that are so useful, by making people buy into them. It'll reduce them, and then they'll take away personal budgets. That's a sort of cynical view, but so that's one of the concerns, I think, in the third sector.
Well, for the smaller groups, I think, that haven't received funding traditionally, there are quite a lot of opportunities to get small amounts of money through personal budgets, and also by selling services that people want. So if it's a culturally specific group with language skills, they could be selling PAs or group activities to people that are on personal budgets. And likewise to the consortia that have got block contracts, if they're small organisations, as long as they're very clear about what they're offering, there's the opportunity to be spot purchased for services for people that don't meet the FACTS criteria. I think for Health and Social Care Forum members who are medium-sized and traditionally have got their money from local authority and the PCT, it's a much more worrying time, because they have been quite secure, and now the personal budgets are not a secure way of getting money, because the service user can change their mind and go somewhere else at the drop of a hat, and there's nothing you can do about it. And likewise, spot purchasing obviously isn't secure. It's a one-off payment for a service. It may last a year, but it would be one element of a service. So for those groups that have traditionally had contracts, they are having to retender, and their funding is much less secure than it has been in the past. And obviously we all know there's a lot less money around generally, so there are opportunities and there are threats for organisations.
Yes, I think that the personal budget is the clients. They are sensible enough. But after they got the budget, they will use it sensibly to buy into the services, like the Meals on the Wheels, like the lunching cup services, like the carer services, like the DIY, all these kind of services. But then after they receive the lump sum, they may refrain from using the money to buy into these services, because they think they have other better way of doing it. But at the end of the day, they may not have any proper lunch. They don't go out, or they don't employ the carer as such provided by the agencies, although there may be good and bad things. But instead of it, they keep the money rather than using the money sensibly. I think that's our worry. I think the council, the authorities have to help us to become advocates. They need very strong advocates to help them to utilize the money, and also to help them to fill in the requirement of our personal budget, accountants, their visions, the way of using it, and for a better life and better budget and better use. Otherwise they lose out because they're not prepared for it.
Advocacy is really quite important in personal budgets, because it is at such an early stage of being implemented by the government that people sometimes don't know quite what the process is, what they're allowed to do with it, what they're not allowed to do with it. And advocacy is actually about giving information so people can make an informed choice. So people who've traditionally perhaps had their care taken care for them by the social worker, the care coordinator, suddenly being faced with the question of, well, how are you going to manage your care? Who are you going to go to? How are you going to manage your money? What will you do if things go wrong? They need information so that they can answer those questions properly. An advocate who's independent and objective can support them in getting that information, and then also making a choice that is relevant to them, not a choice that is convenient for the social worker, the care coordinator, or the council, but is really relevant to their lives.